It's 9 p.m. and Chris is responding to an emergency call.
Just come straight through, guys.
Little Luku has suddenly lost the use of her back legs. Debbie and her son Jonas noticed Luku starting to stumble a couple of hours ago.
All right, she's definitely got some weakness there. You can see she's propping out, just trying to support herself. Yeah, have you got what you pulled off her?
There are 3 different types of ticks that attack animals. The most dangerous is the paralysis tick that injects toxin straight into the bloodstream.
The hallmark of a paralysis tick is the fact they have 2 lighter coloured legs that are shorter, which are the middle pair, and you can see these ones are lighter coloured and they're shorter. So it is a paralysis tick. You can see the size of that crater. That tick's actually been there for quite a while.
Yeah.
See how she's just doing a little bit of a gagging, almost looks like she's trying to vomit? That's just a sign that she's just starting to feel the effects of that toxin, of that tick toxin around her throat.
Tick paralysis works forward from the hind legs to the head. It's now reached Luku's chest, putting her in the danger zone.
Dogs obviously don't pass away from ticks from having weak back legs. It's when their breathing becomes paralysed and they lose the ability to clear their throat, and they can actually be at risk of vomiting and then inhaling it.
The antitoxin is being administered, but it's still a race against time.
If I had to say what my biggest worry with Luku was right now, it'd be aspiration pneumonia. It's the #1 killer of dogs with tick paralysis for a reason. It just shuts down their ability to breathe, and they can't survive that. I'm just looking for any dramatic changes in her breathing or her heart rate. For Luku, it must be an incredibly weird but also scary feeling to all of a sudden lose control of your body, to not be able to move your back legs and then not be able to breathe, to start to asphyxiate. And that's what she's going through right now.
The antitoxin is now fighting the poison in Luku's system, but it will take several hours before Chris can be sure that it's been successful.
Yeah, she's not air conditioned.
No. That's probably a response to the toxin.
Yeah.
If she makes an attempt to vomit and actually doesn't bring it up properly and then takes a big deep breath inwards, then that vomit goes straight into her lungs, and from there she can't breathe through that, and it could be the end of her. Yeah, Luku, can you feel another tick on you? If so, you got to tell us where it is. Otherwise, we've got to spray you. We've got to spray you, don't we? Yeah, that's what I thought. Okay.
Luku is being given a spray treatment to make sure there's no more paralysis ticks lurking in her fur.
Yeah, you look a bit rough there, Luku, don't you? Huh? Maybe tell her the guy in the blue shirt isn't all bad and she doesn't need to be shaking like that.
I think she knows that already. They suss people out pretty quickly, don't they? She knows you're on her team. He's on Team Luku.
I hope so. Even though I've given Luku that antitoxin, it doesn't mean that everything's going to be okay.
Oh, she's shaky.
They can still get worse for 24 hours after you remove the tick. The antitoxin helps, but it's not a cure straight away.
All right.
Okay.
I'll leave it with you. Thanks so much. Thank you.
Okay. Even though Debbie has left and has said goodnight, I just know she'll go home and she won't sleep. She'll be sitting by the phone waiting, hoping that it doesn't ring, because she knows that if the phone rings, it's not going to be good news. Is that Miss?
It's now 1:30 in the morning. Chris and Erin will take turns keeping an eye on Luku.
I know it's not the most comfortable sleeping position. Yeah, I know. But helps you breathe. The worry I have is if she has a vomit and we're not watching. If she does, if that goes into her lungs, she pretty much has no chance. I'm not going to be able to sleep if she's like this, so I'll take first watch. How about that?
All right. 2 hours on, 2 hours off. I'll see you in 2 hours.
I'll be here looking at her, and she'll be here looking at me.
All right, lights?
Yeah.
See ya.
Sleep well.
I'll try.
Hey, how is she?
Yeah, go have a look for yourself. You'll see.
Next morning, after catching up on some much-needed sleep, Chris is back at the clinic to check up on his tick patient Luku.
Hi, Luku. You're walking.
The lucky survivor's legs are still wobbly, but definitely working.
Luku's gone loco.
There are, however, some telltale signs of the toxin still attacking her system.
Luku can't go home for another 24 hours, even though she looks so good. It's because her gag reflex, that ability to stop herself from inhaling a food, still isn't strong enough. Still not much of a gag there, is there? Huh? If she was to have a meal right now, there'd be a decent chance that it'd end up in her lungs and that could kill her. You know what, though? You need to rest. You mightn't think it, but you actually do need to rest. You can't take on the world right now. Luku, can you eat safely, huh? You ready? Well, it's gone. There was meant to be some suspense there, but you swallowed it.
At Bondi, tick patient Luku is now eating without any problems
Lick clean.
and has convinced Chris she's ready to go home.
There you go.
Hello, Luku. Hello, darling. Oh, you're better. Oh, sweetness.
All 4 legs in full working order.
That's the way we like you. You're going to get in one more lick?
No legs? You just want to go, don't you? I thought so. See you, Debbie.
Thanks a lot.
That's all right. No problem. Bye-bye.
Bye. I'm sure she'll remember.
Oh, that's what they all say. Rejection, it's a hard one to take.
There's Pickles. The owners are a bit concerned because he's not walking properly.
Yeah.
And he's been moaning.
Okay. Hey, sweetheart. Can you come out?
6-year-old ragdoll cat Pickles has been rushed into the Bondi Referral Hospital SASH with some distressing symptoms.
He's not really moving his legs very well. There's a bit of movement, but they're really weak.
Owner Jenny became concerned when she noticed some worrying signs at home.
He started not moving properly. We noticed that he couldn't jump up onto a ledge. His back legs seemed to be not working.
All right, sweetie.
As soon as I see Pickles, I can tell straight away he's not walking the way he should be, and his meow sounds different. To me, this is pointing to a tick, but it's really out of season, so it would be very unusual to get one at this time of the year, but all his signs are pointing towards that.
The coat is so thick that if he's got a tick, it's not going to be easy to find it.
I'm running my hands through Pickles' fur, and it's something that's making my job very difficult. The longer that tick is left on his skin, the more time it's got to inject that potent toxin into his system.
Okay, I think I found something. Yeah, that's a big one.
There it is, a paralysis tick. Now, this can be deadly for Pickles. He's already showing the signs. I need to get this little creature off as quickly as possible.
Ah, you're a brave boy. He's really stuck in there. Okay, here we go. Got it. That is a big tick. Okay, we got our answer. Let's get him treated.
Okay.
The next step is to give Pickles some tick anti-serum, which is kind of like snake anti-venom. It's going to go into his bloodstream and bind to any of the toxin that's circulating there to prevent him from getting worse.
All right, sweetie. I'm gonna get this tick anti-serum into you. Okay.
At SASH, the poison from a deadly paralysis tick is shutting down Pickles' system. Lisa urgently needs to get life-saving anti-serum into him before he's completely paralysed.
All right, Pickles, we're gonna pop you in the bed now. Okay? That's the way, sweetie.
Animals that have tick paralysis can get worse and quickly, because if that toxin starts to paralyse his breathing muscles in his throat and between his ribs and his diaphragm, then this cat could end up on a ventilator.
All right, Pickles. Hey, you're a good boy.
Lisa now needs to break the news to Pickles' anxious owner Jenny and her kids Jessie and Amy.
Hi, I'm Lisa.
Hi.
We found a pretty big tick on Pickles' back.
Okay.
You want to come and see him?
Yeah.
Come through.
Okay.
They'll be allowed a brief visit to see their beloved pet before he settles down for the night.
He's just through here, having a little rest.
Oh.
Give him a big cuddle.
Hey, sweetie. Hey. Hey. Oh, he's still so quiet, isn't he? Look at him.
It's really important that he's monitored quite closely in hospital. They can get worse in the first 24 to 48 hours before they get better. We just got to hope that he doesn't get any worse.
Yeah.
We're also going to then give him a bit more sedation and shave off all his hair. We need to make sure that there are no other ticks hiding there.
Seeing him in the cage like that was actually a bit scary. I think thinking that the tick was out made me think it was all going to be instantly okay, and it's not necessarily, so that's a bit scary. All right, I suppose we should leave you to do your magic.
Okay, Mr. Pickles, you're going to stay with us, buddy, and we'll be in touch.
All right. Thank you.
That's no problem, thank you. Jenny clearly adores Pickles. She wants to do whatever it takes to get him through this. She thought, we'll give him the tick anti-serum and he'll be out the door. But when I tell her the news that it's 24 to 48 hours, that he could deteriorate despite us treating him, is terrifying for them. I know he's got a beautiful coat, but we've just got to get all this hair off and make sure there are no other ticks hiding there.
Also at SASH, as life-saving anti-serum gets to work, Pickles is undergoing a radical precautionary haircut.
Okay. So there's no more ticks, which is great. So we'll just keep a really close eye on him now. Keep him nicely sedated and watch his breathing. Okay. Some animals will follow the textbook and get better within a matter of time. Others will seem like they're okay and they'll deteriorate out of the blue. We can't take our eyes off Pickles because if he gets worse and we miss it, then he could die. All right. You're okay, Pickles.
Pickles will now spend the next 24 to 48 hours under observation.
All right, sweetie. I'm gonna watch you. Okay. We've given him all the treatment that we can do for now. The rest is just going to be monitoring, watching his breathing and hoping that he doesn't get any worse. Pickles, look at you up and about.
At SASH, it's been 24 hours since a life-threatening tick was removed from 6-year-old ragdoll cat, Pickles.
Hey, you want to get out? Let me have a look at you. Hey, he's a happier, stronger cat. Today's a really important test for Pickles. I need to see if he's getting stronger, how his breathing is. I just hope that he's made some improvement today. Sounds good. You're breathing nicely. That looks great. Sounds great. You're much stronger, look at you. Huh? Standing up. That's what I like to see. Good boy. I can't wait to show Jenny and the kids how well Pickles is doing. When she left, she didn't even know if she'd get him back home. And I think when she sees him now, she will be over the moon. Hello.
Hello. Oh no. Look at him.
Oh my gosh.
Oh, Pickles. What's happened? Oh, look at him. Hey. Oh my God. Well, Pickles is not looking like Pickles without his hair, but he's definitely looking a lot more alive. It's just such a relief.
All he's going to need now for the next couple of weeks is going to be rest at home, inside.
Inside, okay.
Only inside. Let him recuperate. It's going to take a couple of weeks for him to get back on track. But he's definitely out of the danger zone. He's just a lucky boy. Jenny, Jessie and Amy are so excited to finally have Pickles back in their arms. Even though he doesn't look quite like himself, I don't think they were expecting to get him back this soon.
See you.
See you later. Bye. My pleasure.
This is Boston.
On the Gold Coast, German Shepherd Boston has been rushed into the Animal Emergency Service after his owner found him on the floor, unable to walk.
Hey, big man.
Vets Dr. Alex Hines and Dr. Gerardo Poli need to urgently find out what's wrong with this distressed shepherd.
The owners came home, or they were away last night, and they came back this morning and found out he couldn't really walk properly.
Well, his breathing sounds a bit noisy too.
Yeah.
So just not walking properly, anything else?
Yeah, as far as I'm aware, I think they think it's a tick.
Okay.
Paralysis ticks are so deadly because they inject a poison that causes widespread paralysis, not only of the back legs, but also of the breathing muscles, and that's life-threatening.
I don't know how we would ever find a tick with all this hair.
Should be a prize for the person who wins, eh?
Who finds the tick?
Yeah.
Gosh, it's hard to even get your fingers right down to his skin.
Boston is showing all the signs of a patient severely affected by tick paralysis. Every breath is laboured, he can't stand, he's in real trouble.
If left untreated, tick paralysis can cause death in dogs in as little as 24 hours.
Okay. Oh, it's okay. I know, so many hands over you, mate, so many hands. Just back, lots of pats.
I think I can feel something.
Oh, if you found that quick, you must have magic hands.
Oh, there we go. That's a pretty big tick there as well. Ouch.
Oh, it's still moving, its legs are moving.
You're right to hold him still. Let me see if I can pull it out. This might hurt a little bit because his skin looks really sore around here. Oh, God, this thing doesn't want to let go. Oh, I'm sorry, mate. Good boy.
Wow, it's amazing how something that small can have such a deadly impact.
Yeah, it's pretty incredible, isn't it?
He's such a big dog.
But that would be enough to cause the kind of paralysis that he's showing. I think he'd benefit from some sedation, wouldn't he?
Yeah.
It's just, even to help that upper airway breathing.
Now that we've found the tick, it's vital that we get Boston onto some oxygen because I can see that he's already suffering from breathing paralysis. And then we can start the tick anti-serum.
We're still going to have to clip all his hair off because we don't know that there's not another one there. But in the short term, he really needs the tick anti-serum because the toxin is circulating around his system at the moment. And the quicker we get the anti-serum on board, that will allow it to start neutralising the toxin. Come on through.
Before starting treatment, Alex is bringing through owners Rebecca, Wade and little Harlow to say goodbye to Boston.
You couldn't go and not say goodbye, I think, and especially for my little one. Got to give him love and stuff like that and make sure he's okay before we leave.
There he is.
It wouldn't be home without Boston. He makes our family whole. He's the best dog. He's just so good with our little one. She climbs all over him and he's just so patient with her and loves her. I feel like with dogs, when you look into the eyes, you can kind of see what's going on and he looks very sad, struggling.
He looks sad.
He's a bit sad, yeah. Big cuddle and kissy, say goodbye.
Okay, guys. Say see you soon, Boston.
I really want to clip Boston's hair to be sure there are no other ticks, but he's too unstable. We're going to have to leave him for tonight, and tomorrow morning, hopefully he'll be well enough that we can do the clip.
I'm really worried about him, Drado.
At the Animal Emergency Service on the Gold Coast, 4-year-old tick paralysis patient Boston has taken a turn for the worse.
We've given Boston sedation, and that's helped, but his oxygen levels are dropping. I want to get the tick anti-serum on board, but at this stage, I have to get him stable. His oxygen levels are dangerously low.
Come on, Mr. Boston. Hey.
I'm becoming concerned that we're going to have to intubate him, take control of his airway, and put him on life support.
It's really gurgly. Just wondering if we even got to suction him, even in his mouth. Hear that? He's real gurgly.
We try an oxygen mask, but Boston's fighting it. It feels claustrophobic. I know we're going to need to put a nasal line in if we're going to help him with his oxygen levels.
This is definitely better than him just having a mask in front of his face he doesn't tolerate. And it's much better than him breathing room air, so he needs this.
Boston's oxygen levels improve and we don't have to intubate. We're going to wait to clip the rest of Boston's coat. We know there was one tick, there could be more, but at the moment the priority is to get the tick anti-serum on board. Yep. Okay, that's running. Once that's into his bloodstream, neutralising the toxin, I'm hoping we'll get him to turn the corner. You can hear that noise that he's making. Each breath is taking extra effort, and that's a real worry. If his breathing slows down, then that's where we start to need to intervene, and we may even need to take over the work of breathing for him. Oh, mate. There's not a lot more I can do for Boston right now, but I am really worried. I'm going to be checking up through the night, and I can't help thinking about that family at home who are just hoping he's going to pull through this. It's touch and go.
There we go. Okay, good boy, Boston. Hey, it's quiet in here, mate.
Boston's condition has worsened. The German Shepherd is battling deadly tick paralysis, and Gerardo is deeply concerned.
Boston's pretty serious at the moment. So what's happened is the toxin has still had an effect, and the anti-serum mops up the toxin in the bloodstream, but there's still toxin bound to his nerves, and that's his own immune system will have to get rid of that over time. So generally what happens is a little bit of a deterioration over the next sort of 6 or 12 hours, and he's kind of deteriorated quite rapidly.
Boston has been transferred to the intensive care unit as his condition is now critical.
The nursing care is more intensive, so hopefully that's enough to keep him stable, keep him comfortable, so we don't have to progress his care into mechanical life support.
Oh, Boston. You're really paralysed now. What happened? It all just went downhill. Your family's going to be so worried about you. We knew that this could happen, Boston, hey, but I was really hoping it wouldn't. But you definitely are worse than yesterday.
Alex fears the poison from a deadly paralysis tick may have done too much damage before the antivenom could take effect.
He's now got 2 oxygen lines in. He's definitely still putting a lot of effort into breathing. We're worried about what we can hear on his chest sounds, and we think he might have aspirated, so we think he's developed pneumonia. So we're going to want to take some chest x-rays, and then we'll know how bad this is. Good boy. In we go, Boston. Good boy. It's okay.
Okay, big fella. All right, we're ready. You all right?
Boston's x-ray, it doesn't look very good at all. What I'm seeing is almost complete consolidation of the lung. This is pneumonia on a massive scale. This has added a whole level of complexity to Boston's condition. It means that not only is he dealing with the tick paralysis, but he's got a severe pneumonia, and this could be the part that's life-threatening now.
Yeah, sorry, mate, you're going to lose all of that beautiful hair.
Rosebuddy.
With paralysis tick patient Boston's health deteriorating, the decision is made for Vet Allstars and vet nurse Natalie to go ahead with clipping his fur in search of further ticks.
Poor Boston, he's now got paralysis and pneumonia. We've started antibiotics for the pneumonia, but the next step is to clip this hair off. We've got to make sure there's no more ticks.
I'm amazed that they found the first tick under all this hair.
Boston is now at the stage where he's completely paralysed in his body. He can lift his head, look around a little bit, but that's about all he can do. What that means is we have to help him with all his bodily functions. He can't even go to the toilet on his own. So we're going to need to put a urinary catheter in. We have to put cream in his eyes because his blinking is affected. All these things become paralysed as part of the condition. I'm worried there could be another tick there. 10% of patients have a second tick. And if he has a second tick somewhere hiding in this big furry coat, then it will kill him.
Boston's owners, Beck and Wade, have come for a visit, desperate to see their sick boy. But a decision has been made to keep them at a distance.
It's extremely hard for owners not to be able to come in and visit when they have tick paralysis, but we have seen animals before, like Boston, that are just coping okay on their own, that when they see their owners, they get so excited and their bodies just can't cope with that extra bit of stress. So Yeah, you know, you always think they're going to be so much better coming in and seeing you, but actually in this case it can be really dangerous for them.
He's getting all his hair off.
Poor thing.
Yeah.
He looks so sad.
Yeah.
So we were obviously just hoping to go see him and just give him a cuddle, make sure that he was doing okay, and to reassure that we're still here and, you know, hoping for the best for him sort of thing. And I don't know, didn't know really what to expect. We got lots of phone calls last night, which was really good. Just kept us, you know, in the lurk and know what was going on. So, yeah, we just wanted to see an improvement. So what sort of journey do you think he's going to be on?
The pneumonia, to be honest, has set him back a little bit.
Okay.
Yeah. Because it's just given him another thing to fight. Okay. So it really is a matter of just watch and wait a little bit. There's only so much we can do for him, do you know what I mean?
Yeah.
And a lot of it's going to be up to Boston to fight this.
I feel very nervous, constantly just anxious, because we just don't know what's going to happen, because obviously he's got pneumonia as well. So he's got an extra thing he needs to fight and get through. So Boston's not out of the woods. It's sort of touch and go.
The clip is over. It was a marathon effort, but well worth it.
And we're done. Good boy.
Good boy. No more hair for you. And we didn't find a second tick?
No, we didn't find any additional ticks.
Okay. I feel much better now the hair's off. We know for sure it's just that one tick that was causing the problem. So I think at this stage, we've really done everything we can for him. He's had his clip, he's had his tick anti-serum. It's really up to Boston now to fight this and get better and get home. Yeah. Hey, Boston. How are you doing this morning? You're still on your oxygen by the look of it. It's been 2 days since Boston came into intensive care. It's good to see that the paralysis is wearing off, but the pneumonia, it still has him in the danger zone. That breathing still sounds a bit rough, hey, mate? Hey? You just look tired. How are you going with your walking? I just wonder if we might give you a little bit of a trial around and see if you can get up and about. He's blinking, and he wasn't able to blink when he first came through into the ICU. So those things, as they improve, they tell us that it's less the paralysis that's holding him back at the moment and more the pneumonia. You going to show me what you can do? You can come for a little walk? Come on. Good boy. That was really good. Hey? Take it slow. Oh, you're off. That's great. Good job, Boston. Yeah, there's not much of you under there. Now you've got no fur. Oh, no, don't go check out the other patients. If you're walking that well, you might even be up for some food pretty soon. Good boy. It may not seem like a good thing to see a dog wee inside, but this is really good for Boston. It's an important step in the recovery of tick paralysis because it really shows us that the paralysis is starting to wear off and he's able to resume those normal bodily functions on his own. So good on Boston for having a wee. Is that your bit of exercise for today? Do you want to hop back into bed? I think you'd be better off in bed. Good boy. Can you sit down? Oh, yeah. I know. Get you connected to your oxygen again. I can't even think about Boston going home until he's off the oxygen and breathing on his own. Right now, he's a long way from that.
You're feeling much better now, aren't you, Boston? Hey, you're such a good boy. Hey, you want to go home today? That'll be pretty exciting. You're going to see your family again. Good boy, yeah.
It's been 5 days since German Shepherd Boston was bitten by a deadly paralysis tick and left fighting for life. After a week in intensive care, he's finally on the mend.
Hey, how's it going?
Hey, yeah, really well. He is doing fantastic.
So what's the verdict? Do you think he's good enough to go home?
Yeah, I think he's ready to come home. He is off oxygen, he's had some dinner, and he's up and walking around.
That's so good.
Hey, Boston. Hey? Are you a good boy? Thank you. Thank you, buddy.
I am so thrilled that Boston is going home today. There were moments where I wasn't sure if he was going to survive, and just being able to take him out to his family, this is going to be incredible.
Hello.
Does he look a bit different?
Yeah, he looks a lot different.
He's so different.
Buddy?
Oh, boy.
Hey, buddy.
Yeah,
buddy.
what do you think, Harlow? Did you still know it was Boston?
He knows Boston?
Hello, boy.
Aww.
That's the happiest he
looked a bit unsure. He was like,
Hey, boy. There's a boy.
he looks so different. But he's still our baby. Yeah.
It can be really tough as an emergency vet. It's long hours, it's tough work, there's big decisions to be made. But seeing patients like Boston go home today, it's so worthwhile. This is why we do it.
Eddie, you be a good boy. Are you going to take him out? Yeah, he's not going to be...
Not that way.
This way, Boston. Come on. Let's go, boy.
Yeah, hold on tight.
Hey, Mr. Tim.
Go ahead, Hales.
Hey, could you come down to Koalas, please? There's a bit of an issue.
Roger, now?
Please.
On my way.
At the Australian Reptile Park, Tim's answering an SOS from one of his keepers.
Hi.
Hey, what's up?
It's got an unwell koala.
Who is it?
This is Polly. A couple of days ago, she had 8 ticks on her, which is really strange.
Yeah.
She was found on the ground this morning. Her eyes were really puffy. I'm really concerned, just because she's got that little 6-month-old Joey in there.
Hayley's explained the signs that her and the keepers have picked up on. Mum's been on the ground, Mum's acting abnormally, Mum is constantly eating, Mum's a bit puffy around the face. They're all red flags in their own right, and we've got 4 of them.
Oh, you got another tick. I just felt it. Where was it? There.
Blood-sucking ticks are not uncommon in koalas, but if Polly's infested with them, she could be suffering severe blood loss, which could lead to anemia.
If we have an unhealthy mum, one of the first things they'll do is abandon their joey. It seems really odd to us, but marsupials, she'll abandon the joey and in her mind she knows, I can have another one. It's wet, it's cold, the joey won't last an hour outside of the pouch. We're gonna have to do something. I'm gonna go up and grab some equipment to weigh her, chip her and have a bit of a look, and I think you probably should start getting some pap.
Yep.
We've called the vet and Hayley is gonna begin the process of papping. When a joey is born, the only food they eat is eucalyptus, but joeys aren't born with the enzyme in their stomach to digest eucalyptus. So Mum makes herself go to the toilet until it becomes a runny substance, pap. The joey eats it. If we don't get pap from Mum now, the joey's doesn't stand a chance. How you going?
She's got the gaze and the spasming has started.
Oh, look at it in there.
Can you see it?
Yeah, are you happy?
Yeah, this
You
is
got
the
it?
good stuff.
Look at that. Perfect.
Pap is essential for baby koalas so they can transition from milk to eucalyptus leaves.
Have you weighed her today?
No.
Okay.
But first Tim wants vet Robin to check Polly to see if she's well enough to look after her baby.
Yeah, let's weigh her today and see where she is. Grab the stick. Grab the stick. Okay, good girl.
You got?
7.25.
Yeah, she's 400 down.
Wow, that's a significant amount of weight loss. It's very concerning for sure. That baby's pulling her down. We don't like pulling the joey, but if the joey is causing an issue with her health, for the safety of the joey and for the safety of the mom, sometimes we have to take the joey and let somebody hand raise it. Yeah, that one definitely was a paralysis tick. You have the head still in there.
It's not surprising Polly's condition is so poor. Her tick infestation is much worse than first thought.
Why are there more ticks on a vulnerable, weakened animal than a healthy animal?
I think because normally they would get them off before they would attach.
Right.
So the same reason why you rarely see them in cats, where you see them in dogs, is cats clean themselves. Koalas constantly are cleaning.
Yeah, they've got the double claw.
Exactly, so they use their cleaner claw and they take them off. So she's so focused on feeding herself and eating, she's not taking, grooming and taking care of the ticks. To find ticks on a koala that tells us that there's something wrong with her immune system or with her general overall well-being.
Tim is now starting to get increasingly concerned that Polly is far too unwell to care properly for her joey.
You're right, Paul.
The team make the difficult decision to take the joey away from its unwell mum.
You can see the arm there.
Yeah,
it's fully fed.
She's fully fed. It's actually a good state. I bet it's
there. It's fed.
Hey, sweetie.
Hey, honey.
Good girl, Paul.
He's a little dehydrated. His eyes are a bit sunken in his head. He's fully furred, which is a very good size to try to hand raise, and he's a little on the thin side.
Yes.
This is definitely the right decision to make. This is the baby's best chance.
Right.
Okay, baby. Okay, baby.
We've decided that the Joey will be artificially reared by Hayley. Tough decision, but this is in the interest of having the Joey and Mum survive. And we cannot say that that's a certainty if we leave it like it is.
What's happened there?
That's a cut. That's not even part of the teeth, that's the edge of the pouch.
Goodness.
As vet Robin continues to check over Polly, she makes a shocking discovery.
She's ripped that on something?
Yeah.
Probably climbing amongst the branches.
She must be in so much pain there.
Yeah, something's ripped that.
We're so lucky that she hasn't already thrown that Joey.
I know. So we'll flush it with a little bit of saline first, just to clean off the debris. And then we'll apply a little bit of antiseptic to it. With this injury, the pouch won't close very well. And it would make it difficult for her to keep the Joey nice and warm. It would also hurt.
Yeah.
It's right in the edge.
How old do you think the injury is?
Only a day or two, not very old.
Really? Well done to the team. I mean, to pick up just on her behaviour, that's quite incredible. You think it'll heal okay?
It should. We'll have to watch it and see because it's actually the rim of the pouch.
Yes.
It's all right, Paul. It's all right.
Okay, almost done. Almost done. And I think probably the Joey would, every time she would move, it would hurt.
It would hurt.
Yeah. It was very important that we intervene because we probably would have lost the Joey. And if the Joey was continuing to at least get some nutrition from the mom, we potentially could have lost Polly.
She's good?
She's good.
Okay, well done, Paul. Well done. Up you go. A best case result here is that Mum recovers because she's been under quite a burden rearing that Joey, and Joey survives with Hayley, who's done many of them. She is Koala Girl.
Hayley's going to rear her.
Yeah.
Do you have a name?
I think in light of the recent bushfires, I think Ember would be a really nice name.
Ember.
I like it.
Good looking koala.
Very good looking.
In the recent 2019-20 bushfires, we lost so many wild koalas. It was just devastating. And so when we see a little Joey born like this, it just makes our heart melt.
Well, you ready for more sleepless nights?
6 months of them. Yes, always.
You're not feeling good at all. It's okay. It's all right, you know.
Little Jack Russell Pup Scout has been rushed into the Bondi Referral Hospital SASH after becoming ill and collapsing at home.
This little dog's only 3 months old. He's been wobbly in his back legs, he's groaning, he's had some vomiting. I'm really worried that he's got a tick.
It was devoted dog sitter Kathleen who brought Scout in, convinced he's suffering from tick paralysis.
We're looking after these two puppies, Scout and Bella, and we got home and there was clearly something wrong with Scout. So we phoned SASH, we rushed over here and they're busy looking after him at the moment, so we'll see what they're going to say.
Okay. Something is seriously wrong here. His voice is paralysed and he's really swollen around his mouth. Hey, buddy. I don't like how you're making that noise.
It appears that poison from a tick has already begun shutting down little Scout's system. It's now a race against time to find the tick before it begins paralysing his breathing muscles.
Where is the tick? Where is your tick, buddy? Every minute that we wait, it's injecting a lethal toxin into his system, causing this paralysis. We need to get it out of him and treat him as soon as we can. Okay. Oh, here it is. All right, buddy, we found it now. That's okay. It's right around his lip. There we go. Oh, sweetheart. So we've taken the tick off Scout, but the treatment is nowhere near over yet. Now we need to sedate him, keep him as calm as possible, give him some life-saving tick anti-serum, and hope like hell that he doesn't deteriorate. All right. It's okay.
At SASH, the poison from a deadly paralysis tick is shutting down little Scout's system.
It's okay. All right. The worst is done.
It's now a race against the clock to get the tick anti-serum into him before he is completely paralysed.
We are under the pump here. We've got to get this into him really quickly because if we delay it any longer, he can get worse and fast. It's all right. Hold on. Scout's had his tick anti-serum, and next we need to shave off all his hair to make sure that there are no other ticks hiding there, and then we'll give him a spray with a tick treatment just to be safe.
He's a brave puppy. You're all right. Good boy. Sorry, Scouter, we've just got to make sure you've got no ticks left. I know you're sick of it. You're being very patient. Just got to make sure we've got them all so you're not going to get any more sick.
Suddenly, the nurses discover 2 more ticks burrowed deep within Scout's skin.
It looks like a baby tick. Just right there on his belly.
Oh, sweetheart. The poison from one paralysis tick is enough to kill this tiny puppy. With 3 ticks, Scout is now in serious trouble.
Scout is really anxious and distressed. The most important thing I can do now is sedate him, keep him as calm as possible, because if he stresses out and panics, he's at risk of aspirating, obstructing, and that is life-threatening.
Devoted dog sitter Kathleen and her 3 children are allowed in to see the sick pup.
I feel really sorry for Kathleen. I can't guarantee 100% that he's going to survive. He could deteriorate in the next 24 to 48 hours, and all I can do is hope that it doesn't happen.
Okay, you're nice and cozy there. We're going to get you feeling a lot better, sweetness.
At Sash, Lisa's worst fears are realised. Tiny tick victim Scout is in the oxygen chamber, fighting for his life.
Scout's taken a turn for the worse. He's developed breathing problems. He's now in the oxygen cage, heavily sedated. I was hoping that it wouldn't go down this path, but it might just be a sign that we've caught him too late.
All that Lisa can do now is hope and pray that Scout can find the strength to pull through.
I'm just really upset that he got to this point. He's such a tiny little puppy, and now his life is really hanging in the balance.
Have a little rest now, honey. It's a good boy. Have a little rest.
Hey. You're looking better. Hey, buddy. Who's feeling better? Yes, hello. Hello.
At Sash, little Scout has made an amazing recovery after being bitten by a deadly paralysis tick.
As soon as I lay eyes on little Scout, I can straight away see that his demeanour has completely changed. That little tail is wagging 1,000 miles an hour. He wants to play, and that's how a puppy should be. Oh, you're a cutie pie.
I think you're feeling better. Yeah, not eating my finger. What about some real food?
The final test in his recovery is to see whether or not he can eat. Wait, look what I've got. Oh my gosh. Oh my gosh. Scout's doing so much better. He's full of energy and has now just eaten a full bowl of food with no problem. So I think he's ready to go home.
No one is happier about the 3-month-old's recovery than his anxious babysitter Kathleen, who's waiting in reception with Scout's sister Bella.
When I heard the news, I just felt a wave of relief. This little beautiful thing is fine. He's young, he's 3 months old, he's full of vitality. Thank goodness.
Let's go. Come on.
Ah, look at him. And he's better. Hey, look at them. They're saying hi. Hey, you survived. You're okay. I can't believe it.
Very close at one stage. Hey? I didn't know if he was going to even pull through, so...
Yeah, I was very worried. And here he is, himself.
Even though Kathleen and the family are not their real owners, the thought of them losing Scout would have been absolutely terrifying, and they are so excited to have him back in their arms.
Here we go, a happy couple.
You guys ready to look after them?
Yes.
Especially this one. Now, you're a handful. You be good.
Can you see?
And be nice to your sister, please. The amazing thing here is that when Scout's owners left him to go overseas, he was healthy. And when they get home, he'll be healthy too. It's like none of this ever happened.
Push, push. Okay, let's go home.
See you later.
Okay.
Good luck. Bye.
Not a crazy one. It's just full of